everybody, welcome to Nurse Table Talk. This is Julie, I'm Nurse
Hi.
Kathy, and today we're going to talk about medication tips. And if our regular viewers are aware, we have done a video on how to make a really great doctor's appointment cohesive and make sense and get the biggest bang for your buck. And we've also talked about medication safety, but today we're going to kind of pull it together, and a couple of things will sort of overlap and might feel like you're watching the same thing twice, but you're really not. But today we're just going to do like some general medication tips, things that Julie and I both agree are really important. And the primary reason that we're doing this is because the mismanagement of personal medications is one of the leading causes of hospitalizations in the United States of America. And so that's why we find it very, very important. Right. Julie, do you want to go ahead and start?
Just a few basics to start off with. So medications, when you go to your doctor's office, any doctor, specialist, whoever, you always want to take a list of your medications with you. They will review those with you. They'll want to know if you're continuing to take them, if you stopped taking them, if the dosage was changed by any of your other doctors. You know, everybody wants to be on the same page. Yeah. And if you don't have a list, really bringing your medications in their original bottles to your appointment is really important as well.
Yeah, just throw them in a Ziploc baggie. Take them in. Yeah. Right. The other thing that we have noticed too is that, and some of this gets kind of confusing, so bear with us because we don't really know if there's a really great way to explain this, but there's always a generic to a brand for medications unless the patent is still only on the brand, and those are usually kind of the more expensive medications. So the newer, trendier medications are usually more expensive than the generic. And it's the same thing as if you were to go to the grocery store and buy the house brand of cookies versus Keebler or Nabisco or whatever. So there are always going to be differences, and that has permeated the medical system as well when it comes to medication. Most doctors and most providers are aware to some extent that people don't want to spend half of their monthly income on their medications. So they generally prescribe the generic version of the same med. It's the same thing. It's just going to be called something different, but it's going to be in place of you paying more money for the same thing. If you take your bottles with you and money is tight, or you want to make sure that you're saving money and you're getting all generics, if that's what you want, make sure you ask your doctor. A lot of people have no idea that Norvasc and amlodipine are the same drug, but there can be differences in price across the board on most medications. So those are things that you're going to want to ask about specifically when they do your medication review with you.
And Kathy, I think that's really important that people ask, because a lot of times people assume that their doctor is aware of all these generics, and that industry changes so quickly that doctors aren't going to be up to date on all these medications.
All the time.
So being proactive and asking about, hey, am I on all generics as much as I can be when they're reviewing your meds? I've done that at my appointments, and just come out and ask them.
A lot of times, unfortunately, the patient doesn't really realize that their medication, what their medication costs, until they get to the pharmacy.
Right.
And they turn in their prescription, and then they get this, you know, you owe me, you know, $950 for your medications.
Yeah.
And so that can be where a lot of times where it becomes sort of disheartening for people. Right. And Julie, you had some insurance information that you wanted to share too, and this kind of pulls into that when you're trying to save money and you're trying to look at why your medications cost what they do.
Right. So first of all, to clarify, your physician and you are the ones that determine what medications you're on. The insurance company doesn't have any voice in that. That's between you and your doctors. However, if you're checking on prices, the insurance companies usually have a pharmacy, a benefit pharmacy. That's different than you going to your local pharmacy. It's to review your benefits.
Yep.
So what I would suggest, if you notice any cost increases, take out your insurance card, look on the back of it. It's usually got the customer service. You call customer service and say, I'd like to speak with the pharmacist or pharmacy department. They will transfer you to that department, and then you can say to the tech or whoever answers, hey, listen, I noticed a cost increase. Maybe that cost increase was because it's a new year, and at the beginning of the new year, you have a medication deductible, and that gets satisfied. And then once that's satisfied, then your costs of your medications taper down to what they normally would be. If you have any medication questions in addition to that, you know, when you pick up your medications, you can always ask your local pharmacist as well.
Absolutely.
But the determination of what medications you're on and what, that's between, any of that is between you and your doctor. So I just want to stress that even though the insurance has a benefit and all of that, they're not involved in those decisions. You and your doctor are. You want to make sure that medication is appropriate for you.
Enough really how it's really important that your doctor knows what you're doing. You're not going to get in trouble. You're a grown adult. If you don't want to take your inhaler, then don't sit through your appointment and act like you're taking your inhaler.
Right.
You have to be honest. Are you not taking your inhaler because you don't want to be bothered, or it doesn't work for you? You can't afford it. Inhalers are expensive. That's why I mentioned them. Whatever reason you're not taking your inhaler, please, please, please let your doctor know. We cannot stress enough the importance of all of your providers being on the same page. If you go to a holistic doctor, if you see somebody for mood, if you see somebody for nutrition and they start you on supplements or herbal supplements, or you're taking something for a short period of time, your doc really needs to kind of know, because they're kind of the person who is able to look at your general medication list and make sure that you're not doing something that you're not supposed to. Your pharmacist is also a really good resource for that too. They're also, you know, they'll pull in the herbals and the supplements, and they'll look at all those things and make sure that there aren't any reactions in all of those medications. But if you choose not to take the medication, it's wise to let your doctor who prescribed it know.
Absolutely. Like Kathy had mentioned, if you stop taking your medications and no one knows it, you could end up back in the hospital.
Yeah.
And as far, one other thought I had too, Kathy, is let's say you aren't taking that inhaler, like Kathy mentioned, they can be very costly. Call your pharmacist, call your insurance company pharmacy first. Let's say you have a doctor's appointment coming up. Ask the pharmacist, are there any inhalers in this class of medicine that I could discuss with my doctor when I go there? Again, they're not making, the insurance company is not making that determination. That's between you and your doctor.
Yeah, they make great recommendations. Yeah.
Right. Yeah. And it could end up where it's a win-win. You're gonna be happy because you can afford to take that inhaler, use it as it's prescribed, and save money in the meantime, and be more informed and be more proactive and avoid a hospitalization, you know?
Yeah, we've seen people take their pills every other day. We've seen people just go cold turkey off of medications that cause like heart arrhythmias.
Right.
And so really the day you start taking that medication is the day that you have to reconcile the fact that you have to talk to your physician about any changes that you make. You just can't go willy-nilly and do your own thing. It's just too dangerous.
Right. You want to be proactive with your own health and be, you know, and avoid a possible hospitalization and be more informed, be a more informed consumer, you know, and you'll feel better and you'll be able to do more things, enjoy life, and everything's good, you know,
So Julie, we're going to cut right now, and then you're going to come back in a super quick 3 minutes with Julie and talk about all the ways that people can get themselves organized for their medications, because that ends up being something else we see a lot. We have both taken care of a lot of patients over our years as nursing who take a blue pill on Monday, a red pill on Tuesday, and a green pill on Wednesday. And we're going to kind of show like how there's maybe a better system. And a quick flip over.
All right. And thanks to everybody for tuning in today. Have a great day. Bye now.
Like the content you just watched? Hit the like button or hit subscribe here. If you want to be notified of any future videos, please ring that bell. If there's any topic you'd like to see discussed, leave us a comment in the comment section. Nurse Table Talk. Save time, save money, be informed. Thanks for watching.